somebody's going to want to get a hold of that list for something other than altruistic purposes. And that's not just worrisome, that's outright dangerous.
Some private medical decisions could become public record in Tennessee. A new bill would require all gender transition procedures to be reported to the Tennessee Department of Health. Good evening and welcome to News 2 at 5. I'm Bob Mueller. State Capitol reporter Tori Gessner explains why some Republicans are pushing this legislation and how the LGBTQ community says it would impact them.
For Darren Johnson, the fight is familiar.
This is not the first time around for this bill. As a matter of fact, this is year 3.
The bill in question would require gender clinics to report certain patient statistics to the State Department of Health every month, including their age, sex, and the county they live in, plus the medical provider's name and any medications they prescribed. That information would then be posted publicly. Johnson compares it to Nazi Germany.
I think any of us who've done our 8th, 9th, 10th grade history, there's bad histories around making lists of folks like that, separating and identifying folks like that.
But the Republican sponsor says the goal is to track trends, not target individuals.
If we're honest with each other, the last 10, 15 years, this has become in vogue. There are things in society that become popular in vogue, and then they go away, and they come back, and they go away. I think it's important on us when something impacts our people as much as transition surgeries have impacted our people. It's important that we kind of know what's going on and see the numbers and see the trends.
The legislation says the data cannot include any individually identifiable health information. But Johnson argues what's collected could still be enough to re-identify patients, especially in more rural areas, and put people in danger.
If you've got a list of folks who are regularly targeted, who regularly have a finger pointed at them, and you know there's a list floating out there. I hate to say that there are bad actors in the world, but somebody's going to want to get a hold of that list for something other than altruistic purposes. And that's not just worrisome, that's outright dangerous.
Johnson says bills like these are a common theme in the Tennessee legislature. The Senate recently passing a measure letting transgender people sue their doctors for, quote, coercing them into gender reassignment decades after treatment. Johnson says it's an attack on the healthcare space, still trying to wrap her head around why the state needs to monitor her care in the first place. Reporting in Nashville, I'm Tori Gessner.
The other part of the bill would also require insurance companies that cover transition surgeries to also cover detransition surgeries. Both the House and Senate versions are one committee away from a final vote.